Hey y'all, it's Dr. Tiffany. I hope you're doing well. Welcome to my All About Measles video. This is going to have basically the epidemiology, the signs and the symptoms of measles, the effectiveness of the vaccine, all of that. This is supposed to be a one-stop shop as far as like measles factoids, okay? So without further ado, let's get started. Okay, so measles is literally the most infectious disease that we know of. It holds the title. It's rivaled only by some of the COVID variants in their initial release. So, but the good news is the vaccine's pretty effective. So most people are very well covered. However, there are some high-risk people, particularly high risk, and those are immunocompromised people, whether or not they've had the vaccine. Pregnant women that have not been vaccinated. Children under 5 years old that have not been vaccinated. And adults over 20 years old that has not been vaccinated. Yes, this is actually quite dangerous in young, healthy adults, by the way. It's now, if there is no immunity, if you have not been vaccinated to measles, there is a 90% infection rate when you are exposed to measles. Make no mistake, if a widespread outbreak occurs, this will get you. You will get measles, and then you will have to deal with the symptoms. It is transmitted airborne. Airborne precautions like N95 masks do keep it away. So we should be, those of us who believe in science, should be fairly well practiced in how to prevent this now. And if you are sick, testing is done by basically the things we all know. Same as COVID, there's an IgM antibody test, which is like a rapid test for measles, and there's a PCR test. Now, there's some evidence out of a new study in Italy that a new strain of measles may be around that is a little harder to detect. That's going to get its own video real soon, but we'll talk about that on that. Now, if you've had the vaccine, one dose is 93% effective, and the vaccine is the MMR, and 2 doses are 97% effective. Adults over the age of 50 can get titers checked. Healthcare workers can get titers checked to make sure that their immunity held. It almost always does, but you can get a test to be sure, and you can get a booster. Okay? Now, post-exposure prophylaxis, if you happen to be exposed to measles, within the first 6 days, you can get a dose of the MMR vaccine, which would decrease the likelihoods of you developing symptoms. And you can get also IgG, immune globulin. That you can't get them together, though. Both will decrease your chances, but they don't make them zero, and they're nowhere near as effective as the vaccine and given before contact. So if you do get infected with measles, the symptoms will appear 7 to 10 days after your infection, after your exposure. It will start with fever up to 105 degrees Fahrenheit. So the fever, obviously, that's an impressively high fever. And also fatigue and malaise, cough, pain in the chest with coughing, and conjunctivitis. Now, these will happen for 3 to 5 days or so. And then after that, around the 10 to 14 day mark, you will develop the classic measles rash, which is basically little red spots all over your body that itch a lot. Okay, I have put the symptoms up here, and there are some pictures of the rash. If you want to look closer at the symptoms, pause, take a screenshot, and zoom in. Okay, so these are lifted from the CDC website. So now you are most infectious with measles at the 4 days before and through 4 days after when the rash appears. Okay, so that's the problem is a lot of infection occurs before the rash appears, and sometimes even before symptoms appear. And with such a long incubation period, people have time to travel, and there's a long period of time in between cases, so a lot of people get lost in the shuffle that way. Now, around 14 days, if you're going to develop the more serious effects of measles, like encephalitis or respiratory failure, that will occur around 14 days. 1 in 1,000 will get encephalitis, and a lot of those will, about half of them will die from it, and most of the others will be disabled to some degree, or a common one is deafness. So 1 to 3 in 1,000 will die due to encephalitis or respiratory failure. Now you might notice that that's a lot more than actually gets the encephalitis. It's because respiratory failure is actually a thing with this, and it's about 1 in 300 or so is the incidence that I've seen. So now this is an educational video. It is for educational purposes only, but this is the measles primer as it will. Okay, I hope that it helps people, and as always, I love you. Stay safe.